Welcome back to the Rich and Mo Physiotherapy series. Hi, Richard.
Hi, I'm
Hi. Today we are going to talk about a very interesting injury, a painful one that a lot of great athletes stop their career due to this injury, and this is called an ACL tear. So talk a bit about the ACL, if you can.
Yes. So the ACL is a ligament, which is a structure that connects bone to bone. This is the knee joint, and as you see, the ACL, if I remove the kneecap and look under the kneecap and bend the knee, I will see the ligament, the ACL ligament, the anterior cruciate ligament, going from the back of the top of this bone, which is the femur, down to the front of the tibia, of the lower bone. Okay, and the function of this ligament is very simple. It limits the forward movement of the tibia over the femur. So with an ACL, I can't do this. So when I walk, my knee, when I walk and I go into full extension, I go full extension and I put the heel on the floor, my knee wants to go forward, my tibia wants to go forward, and it is locked by the ACL. So without this ligament, the tibia will move excessively, causing the knee to buckle and extreme pain. So now, the big question, is physio worth it? Is physio going to help with ACL rehabilitation?
Well, the approach used to be that if you have an ACL tear, you need a surgery. Today it's not always true. Actually, in most of the cases, about 70 to 80% of the cases, you can do pretty well without an ACL reconstruction surgery. The only one that it's automatic to do the surgery are elite athletes, which in this case they need 100% of their ability. For most of the people it doesn't really necessary. Now, as you said, the ACL has a job to prevent this translation, and it's done in two ways. Firstly, it's mechanical structure that block it, like there is a cable in here that stops this translation, but our body is not a machine, it's an ecosystem. So we have also another job. On this ligament we have tons of receptors, really one of the ligament with most receptors in the human body that transmit the brain the information where the knee is in any certain second. And with ACL injury, this receptor get injured. They stop transmitting to the brain. So what we're trying to do in physiotherapy, other than the obvious thing of making the knee stronger and supportive, is also to work on things that reshuffle, reactivate this ligament, let it transmit it to the brain. The rehabilitation program is a long program, even after surgery or without, but it's really worth it. Maybe you can talk a bit about what we're doing in rehabilitation of ACL.
So there's many things in physiotherapy that we do to reproduce the movements that the knee will do every day. So by putting your knee into different types of stresses, it will teach the receptors in the knee to send information back to your brain to say, oh, now I know where my knee is in space. So working on balance, working on agility, working on coordination. This is very, very important. It's not something that you could do on your own at home. So therefore, physiotherapy is, I would say, very, very important if you want to stay active following an ACL injury.
One thing that I wanted to add about it is that even if you decide to do the surgery, the rehabilitation is long. It takes between 8 and 12 months, even for elite athletes, people that are in top shape. It takes between 8 and 12 months, and I always tell to my patients, I just had a patient who decided not to do the surgery after what I told her. I told her that she's not highly active, and I told her that she has to keep in mind that in order that the surgery will be successful, she must do 3 times a week at least of either physiotherapy or physiotherapy plus gym work, at least 3 times a week for at least a year. So if you are even considering to do a surgery, don't just think about the practical part of doing the surgery. The rehabilitation is, in this case, just as important as the surgery itself. Anyway, I will recommend anyone that think that he has an ACL injury, know that he has an ACL injury, to consult with a physiotherapist to try and think if surgery is the right option for him or if he can do well with a conservative treatment. Enjoyed our video?
Please like and subscribe to our channel.
Thanks for watching.